So can we talk about what is dialysis specifically, and does it replace kidney function?
Excellent question. So what dialysis does is it tries to it replaces a small percentage of what the kidney is doing. So as we mentioned, the kidneys are doing a number of different things. So one of the most important things is that they clear the toxins. So when somebody's on dialysis, the dialysis process clears some of those toxins. It doesn't do 100% of what the kidneys was able to do. For example, hemodialysis on a usual prescription does about maybe 15 to 20% of what the kidney's ability of clearing the toxins does. So that's really important to know. One very important information to always be remembering is that the dialysis does not cure the kidney disease, does not actually make the kidneys better. And so a lot of people have the misconception that dialysis actually cures the kidney. It does not. It tries to replace some of that function. So the clearing of the toxins, the removal of the fluid, and correction of some of the minerals and the acid accumulation that occurs with kidney failure. But it does not replace the function of producing the hormone that we mentioned at the beginning of this session that helps to make your body make blood. It doesn't do those other functions. It just does about 15 to 20% of the function of taking rid of the toxins, removing the fluid, and getting the minerals in a bit more balanced level. And as we talked about peritoneal dialysis and the hemodialysis, with peritoneal dialysis, we have a tube inserted into the belly that we wait for it to heal, and then fluid through that tube is put into the belly cavity, and we leave it there. And that's where the toxins from the blood go into that fluid. And then that fluid that's now got the toxins is removed and fresh fluid is put. And then this kind of recurrent thing occurs, like either 4 times a day, where it takes a few minutes to do the exchange, or some people choose to do it overnight, where fresh fluid is put into the belly, the toxins are removed from the blood, and it goes into the tummy cavity, the fluid, and that fluid is gotten rid of and fresh fluids put in, and continuous. Hemodialysis is when a person's blood is accessed, so that's why we always need what we call vascular access. We hope to use a person's own vein and not have to use plastic, but sometimes we're forced to use what we call a hemodialysis catheter, where an intravenous catheter is put into a large vein so that when the person is hooked up to the hemodialysis machine, blood is removed through that intravenous catheter or through the person's vein if they have a fistula, and that blood is then goes through the dialysis machine through a filter, and the toxins are removed, the fluid is removed, and through the dialysis solution that's there, the electrolytes are put into balance. So that's what the process of dialysis is. But it's important to remember, it does not cure the kidney disease, and it does not do the 100% of a kidney function. It does enough to make a person feel well enough to be able to now have quality of life and live.
So Dr. Kiaii, you just mentioned dialysis. Is that one of the treatment options that are available for kidney failure?
So I just want to make sure that it's very clear that there's many different treatment options, and that's why it's important to be seeing a kidney doctor and a kidney team early on. In terms of moving forward with doing some kind of therapy, there's preemptive transplantation, which we're really trying to make sure that we provide as an option for patients. Again, if you've been seen early, we have time to prepare, we have time to see if there's possibility of living organ donation, and so that can always be an option. For some situations, there's conservative care is actually the better option for that individual, meaning that in their situation, maybe dialysis would not be something that is something that they wish to pursue, and so we can actually take very good care conservatively of the symptoms moving forward. So that's always an option for people, and they don't ever have to feel like they don't have that ability to make that decision. Other than that, obviously, to replace some of the function of the kidney when time comes, then dialysis would be the option. And dialysis can be done in two different ways. We can either use the abdominal cavity to do it, or we can use the blood, and the first one called peritoneal dialysis, the second one called hemodialysis. So there is two different options. And again, we like to partner with our patients to make sure we choose what is the best type of treatment for them.